The federal government said it has approved the payment of an recruitment allowance of 25,000 naira per quarter to medical and dental doctors in hospitals, medical centers, and clinics in the federal public service. The allowance is to be paid from the overhead budget. In a separate circular, the federal government said it had also approved a 25% increase in consolidated medical salary structure, CONMES. But on Saturday, NARD's president, Emeka Orji, said the association had rejected the recruitment allowance as it does not meet the doctors' demands. It may be worth quoting the NARD leader, so I quote him. In the letter we wrote to the federal government last year, we also asked for instrument allowances to be included. Many of the instruments in public hospitals were procured by doctors themselves. I buy instruments I used to prepare and operate my patients. These are things the government should be providing, he said, end quote. Now, still with us, to talk about this particular development is Barrister Eze Eluche right here in the studio, a legal practitioner, and of course, like we told you earlier before we went on that brief break, Dr. Ambrose Iwoke, who is the Chairman Guild of Public Affairs Analysts. Barrister Eze, one would say that it is not a recent development. Most public institutions, every sector, when it comes to them having to actively do their work, use their personal money to buy whatever is needed so they can execute properly, whether in private companies and in public companies. So one would say it's not surprising to hear what the doctor is saying, but must it be a constant practice? Must we continue to live like this?
Well, I mean, the request being made by the National President Doctors is genuine, but the thing is, like you rightly asked, what will 25,000 naira buy in terms of medical equipment? And then with the issue of standardization, if every doctor has to go out there to the market and procure his own, how is the government even assured that the syringes bought from market A and that bought from market B have the same quality? So that is not even an amount that should be paid to anybody. It would have been ideal if the government was actually spending funds to equip hospitals, put in place the proper gadgets, and we are sure of the standard and quality of these things. So you begin to wonder the rationale with which our governments even treat medical issues. You begin to wonder, are they really interested in the healthcare of Nigerians? If you have to pay doctors, give them money to go and buy equipment. In fact, when I saw that as one of their requests and what government even acceded to giving, it was clear that something is really, really wrong with our system. And when you also see what they gave the doctors, 25% increment in salaries, it's ludicrous. The government, you increase the price of a basic component in society like fuel by more than 300%. And you now, knowing full well that will have will scale through all segments of society, everything will increase by almost the same level. And you now say, okay, you will now increase salaries of doctors working in the system by 25%. That, I mean, it's simply not heard of. The government itself should have put all these considerations into planning, into its thinking, before even making the increment. Now, you don't first of all create the problem and begin to say, okay, how do we get the solution? Let me give you an example. I mean, in the United States, the average consultant gets paid $95,000 per annum. In Nigeria, you pay the average consultant 900,000 naira, which is like $1,000. I mean, you have to imagine $1,000 for working in your own country. That same person will get $95,000 if he's just to travel to the United States and work over there. So, what will keep him working in Nigeria? And then even those who now decide to stay back in Nigeria, maybe because they've not gotten their visas or whatever, try to make life comfortable for them. But the system is so ridiculous that you wonder, do they really care for us? Because if you don't care for the teachers of our children, those who take care of our health, those who produce the food we'll eat, you don't give a damn for Nigerians, irrespective of what those in government say. Their actions are telling us that they don't care for our lives. If our doctors are not well taken care of, and the teachers are not taken care of, then what else? You don't care whether Nigerians survive or not. This same government, if you recollect, in May, before the past regime of Buhari left, they opened a 21 billion naira health clinic in Aso Rock. 21 billion spelled with a B in Aso Rock to treat how many people? And that's the same clinic that even the first lady was saying does not have paracetamol. I mean, when you you can laugh at it, but it's very serious issues. It shows that there is serious stealing. I mean, when we use corruption and all such hyperfolating grammar, it makes it not real. This is serious stealing, broad daylight stealing going on in government, and they want those who are actually working, those who are actually there for the welfare, well-being of Nigerians to be paid peanuts. You are giving medical doctors 25,000 naira for instruments that you know the real instruments cost in the range of hundreds of millions. If you buy the latest, Google these things, and you are giving a doctor 25,000 naira individually to do what? You increase the salary by 25,000 naira when that amount cannot even fuel a car, a tank of even some bikes. Some bicycles go with 25,000 naira to fill up their tanks. So there is total lack of seriousness. And then this same system, because when I was going through this, the same system will try to make the doctors who are working look like criminals. The person in charge of the budget office recently came out and said some of these doctors who left are still on the payroll. You are exhibiting your ignorance. You are exhibiting your ignorance and your lack of performance. Who is supposed to remove names when they leave the system? I mean, we have to take our society serious, but from all looks and purposes, those who are ruling us do not take us serious, they don't take our life serious, they don't take our welfare serious, they don't even take our security serious. So Nigerians should begin to now think of how do we take ourselves serious to let these people know that indeed our lives is worth protecting and safeguarding.
All right, talking about our lives being worth protecting and safeguarding, we know that doctors endanger their lives every day when they come in contact with people. If care is not taken, they could get infected by, a disease that might be terrible. Now, let me come to you now, Dr.
Like what transpired during Ebola.
Exactly, like what transpired during Ebola. Dr. Ambrose, we know that doctors have been paid 5,000 naira hazard allowance for the longest time. And they have been asking, now one would say, haven't they been patient enough? Because they've been talking about going on strike, they've been clamoring to get an increase. Now, this 25,000 naira is a 3-month thing, which is, if you divide it, it's like you're spending 8,000 plus in a month for a space of 3 months. What do you make of that? Some people will consider that insulting. Dr. Ambrose?
Okay. The doctors in Nigeria are a bunch of endangered species. And why do I say this? The environment in which they work is one of the worst in the world. They expose themselves to so many dangers. Almost all the public hospitals don't have what we call PPE, personal protective equipment, for like reusable things. Doctors use 2 broad categories of things: the reusables, like the needles, injection, this thing they wear in their palms when they want to do this thing, gloves, and so many other things that are reusable. While there are the ones that are static, like the like curtains and all those things. They, like when you talk of equipment for surgery, or even some equipment that they use for surgical operations, there are some that are also reusable, like the surgical knives, stitching, and all those things. Now, most of these things are not even provided for, even as small as bandages and all those things. Many of the public hospitals' capacity to provide these things, because they are being starved of funds from the federal government of Nigeria and from their state government, for hospitals that are private and state-owned. So the doctors, what will they do? Will they allow their patients to die? No. Some of these patients are so poor that they can't even provide those things. So what the doctors have resorted to is to use their own personal funds to now start buying these things. Now, in doing that, it has gone on for so many years. The doctors now said, government, since you are not providing these things and we are buying it, you have to find a way to reimburse us because you're not even paying us well. And that is how these things, came up. These issues came up. So
I think patients actually.
now, when we say some of these things came up, now the government, first of all, are supposed to pay some of these things. Even the little disposables that are supposed to come in the hospitals, they are not providing them. Okay, what of the spirits, the drugs? Most of the pharmacies in these hospitals are empty. People go outside to buy. So if the doctors can just use it at the point of death of their patients, they are providing the money, and at the end of the day, provide it, and the government is still dilly-dallying about that. Even the work of a doctor or a nurse is one of the most hazardous in this country. They call them anytime. They're on standby. They work in a very, very favorable environment. The number of patients to doctors is so high. So, and that is why they are leaving the country. Because our government does not even appreciate the critical sectors in this country: education, health. We are not even looking at that. Meanwhile, we have the temerity to vote 70 billion naira for a mere 450 people to take as allowance. That is not an annual budget. That is just for each member of the National Assembly to take as 140 million naira per person. And you have the audacity to give 25,000 naira to a doctor for 3 months to treat your citizens. So what causes all this is because the public office holders, our politicians, do not use our public hospitals.
All right, let me ask you this now. Let me ask you this: Is the strike action the way to go now? Do you think that will solve any problem at all?
The government has been very deceitful to the Nigerian worker. Don't keep a government that doesn't keep to its own consensus agreements. They will agree with you on something, say we will implement. 3 years, 5 years, 7 years down the line, they have refused to implement and blatantly go about as if nothing is happening. What do you expect the people to do? So strike is the only language that the government even wants to hear, so that they can even call you to negotiate. And what did they do? They threw it at them. Imagine the former Minister of Health in that area, what is his name, said that after all, if the doctors cannot work, they should go and farm. Imagine the kind of intransigence coming out from the mouth of a professor of medicine. These are the kind of people we have in government. Don't care about the citizens. And yet he got away with it. No, there was no protest to force him to resign. And these are the kind of things we see because our public officer holders do anything and get away with it. They keep getting away with these things, they will keep on misbehaving. So the strike from now is the only means. Unfortunately, the masses will suffer, but it's also for the betterment of the masses. The masses should support the doctors. In fact, somebody has suggested so many years ago that the doctors and nurses and all these people should not be going on strike, or police and all these critical sector people. That some people should be going on strike on their behalf. For example, the aviation sector. For example, Pengasen. So all these people go on strike on behalf of the doctors so that we can ground this country. When we ground it, government will listen. Imagine that Pengasen, for example, and all these other Nupeng, these airline operators and the rest go on strike on the same day for the purpose of doctors, for us to settle our doctors. Within 1 week, they will settle them. So it is time for us to see this as collective action.
All right.
Our medical practitioners are depleting every day.
All right. Thank you, Dr. Ambrose. Barrister Eze, do you think Nigerians have been pummeled to a state whereby they can no longer react? He made a very vital point where he said that if the aviation sector decides to drive home the agitation of the National Association of Resident Doctors, and well, he actually gave an estimation of 1 week. I think that before 1 week the matter will be resolved. But do you think it's a situation of let's just continue to work? The important thing is let's keep on getting our daily income. Is that the method through which we see this on reaction from Nigerians? Or could it be that at the moment Nigerians are just waiting to see the outcome at the Elections Petition Tribunal?
Well, these things have happened over the years, and it's not just a one-off. It's not coming because of the Tinubu administration. It's been, that problem has been there for a long time. And like you rightly said, the Nigerian population have been pauperized and even dehumanized, such that people are just trying to eke out a living from the system. And it's like to your tent, so Israel. Everybody's trying to protect their source of income. Now we're talking of only the doctors. It is not only doctors that operate in the medical field. You will be shocked what will happen in any hospital when the cleaners down tools. So when you only give the doctors all these allowances and whatever, the next week, the cleaners, they have the conheads, that's the other health workers, the technicians who work there. When they down tools, even the doctor will run away from the hospital. So this, yeah, because they will not clean and everywhere be messed up. Or even the nurses. The nurses still have hazard allowance of 5,000 naira a month. You wonder, where these policymakers, where they think from. Because the same system that gives doctors, nurses hazard allowance of 5,000, give members of the House of Assembly newspaper allowance of 1 million naira. Housing allowance 300% of their basic salary. So what you see, even for the politicians, is the salary they get. The several allowances are 200, 300% of that basic. So that at the end of the month, a member of the National Assembly goes home with over 40, 50 million naira. And they are the ones that are now telling the medical personnel to take 500,000, 1 million as their totality of their take home. The Nigerian government can be described as wicked. When you look at the realities on ground, these people who are really not can be directly said to be very wicked souls. The reason being that they know the realities. If you can give a member of the National Assembly, and this is the known ones, mind you, nobody knows what gets to the personal assistants and the senior special advisors of these executive office holders. And they are all well off. And the professionals who actually keep society rolling, the doctors, the nurses, the pharmacists, the gynecologists, all of them, you render them so wretched that they, even if they see a job in Benin Republic, they will cross over. And Nigerians are all sitting back, say it's the doctor's own. Tomorrow, the another sector, the lecturers in the schools will go on their own strike. The next day, another group. It is high time we all come together, not just for only the doctors, but the entire society. We have to decide by ourselves, what do we want for ourselves? Does Nigeria have the capacity to take care of itself? Yes. If it's well apportioned. Not when you give 400 people 70 billion and you decide to give the rest of the country peanuts. 400 people who are supposed to represent the rest of the country. So we have to decide what do we want from this country. And yes, people are, if we had a government, these things cannot be addressed in one day. But if we had a government which we see is heading in the right direction, trying to take the people along, Nigerians will take it easy. But when you have a government which starts from day one to buy 2023 SUV cars for the 400 people in the house, give out over 100 billion to so-called Nigerian Judicial Council to take care of the judges, and then the mass majority of the people are just being saddled day in and day out with increment in price of basic staples.
Taxes.
It is high time something happened. Right. In Tunisia, an increase in the price of bread, a basic, by 10% was what led to somebody setting himself on fire, and that was what led to the Arab Spring. Nigeria, we have had increase in our staples by not 50, not 100, at times 300%. And we are still praying that something will happen. Our destiny is in our own hands. We have to support the doctors and other professionals in the health sector and any other person who is working, and ourselves, that this government should be called to order and should not use the Nigerian industrial courts to scuttle genuine aspirations, because that's what they will do. Next, you see that somebody will go to the industrial court, and then the court will now give an order that that strike is illegal. Perhaps even the courts will begin to wonder whether that court itself is illegal. And I'm saying that as a lawyer, because if a court is set out to scuttle justice, you begin to wonder in real terms, is this court just set out there to destroy the population? I know that very soon they will use the Nigerian industrial court to try to scuttle the genuine aspirations of our doctors, and that is unfair.
Not fair indeed. All right, let me come back to you now, Dr. Ambrose. Now let's as you give us your final thoughts on this, we'd like you to wrap it up with what you think doctors can do differently, if there is anything that they can do differently to make their grievances known, and what government can also do to put a stop to these strike actions.
I think at this stage, the Nigerian masses and other contiguous units should not leave the doctors on their own. The doctors have done much they can do. The government is not taking them seriously. And whatever affects the doctors, we are playing with our own mortality, citizens. So take care of the doctors as citizens. Since the government does not want to take care of the doctor, the people should help doctors take care of themselves. So the first thing to do is, for example, to go and ensure that we go to strike on behalf of the doctors and we demonstrate on behalf of the doctors. Okay. There should be, protests organized by, even the NLC on behalf of the doctors. There should be protests organized or strike action organized by critical sectors of the economy, like the airline workers, like the oil and gas workers, Nupeng and Pengasan, so that it can drive home a very critical point that our health is the number one priority. Because if you're not healthy and if you don't have good health services, your citizens will die. And that is why in Nigeria today people are dying. We don't even have common equipment for diagnosis of ailment. Our doctors are second guessing every day. If they will suspect malaria, they will suspect this, they will suspect that. So then, by the time most of our people who have died from cancer are not diagnosed early until they go outside the country or go somewhere else, and then by that time it's always in the fatal stage. This is because we don't have the equipment. Meanwhile, resources are being frittered away on luxurious lifestyle of public office holders. So something must give way. And we cannot pray it away. We cannot be hoping. We cannot be going for where people are sick, carrying them to deliverance houses and praying of night vigils. That is not the way to go. Use the time to...
All right, Mr. Okay.
All right, we seem to have...
They should reach out. Okay. The other unions should reach out. The doctors should reach out to other unions and see how they can synergize so that they can go on their behalf. And this will send more serious message to the government. All
right, and thank you very much, Dr. Ambrose Igbokesh. Let's get your final thoughts now.
My final thought is that this divide and rule mindset should stop. We should take it not just as the doctors, but the totality of the health care workers, the nurses, the pharmacists. They should all be on board, because what normally happens is the government will address doctors' issues today. The next day, the nurses will go on strike. So they should be more altruistic and look at the entire health sector. All the professional bodies, all the unions should be addressed. And whilst addressing them, we also know that we also have to address other segments of Nigeria. Is it possible? Yes. All we need is visionary and altruistic people in government to address these issues. The money they are about to spend on this, the ECOWAS Jamboree, if they devote it to addressing the health sector, it will be addressed. Thank you very much.
All right, then. Thank you very much, Dr. Ambrose Igboke, who is the chairman, Guild of Public Affairs Analysts. Well, I didn't even know there was a Guild of Public Affairs Analysts.
There is a guild.
But it's good to meet you once again, Dr. Ambrose Igboke. And also, you want to say something? Okay, no. And also, big thanks to Barrister Eze Eluchie, who is President, African Center for Health Law and Development. Good to have you with us in our studio.
Thank you very much.
You.
We'll go on a break. When we come back, we'll delve into business, entertainment, and sports.